Hello everybody, welcome to this series of videos on bowel cancer. With Buckingham Palace earlier this year making a statement that King Charles has just received a cancer diagnosis, and last week Princess Kate, the Princess of Wales, has recently had a cancer diagnosis. Cancer is very much in the forefront of the news. 43,000 people in the UK are diagnosed every year with bowel cancer. In the world, 1.9 million people are diagnosed with bowel cancer. 94% of people that are diagnosed with bowel cancer are over 50. Bowel cancer is the fourth most common cancer that's being diagnosed. However, it's a cancer that's not normally talked about. In the UK, 1 in 20 females and 1 in 17 males will be diagnosed during their lifetime with bowel cancer. On a positive note, 53% of those diagnosed will survive over 10 years. Now, just to give you a comparison, only 10% diagnosed with lung cancer survive more than 10 years. Now, this video is Agnes's journey with her battle and recovery with bowel cancer. Agnes, age 50, was diagnosed with bowel cancer in 2023. And this series of videos is to inspire, motivate and give hope for anyone recently diagnosed with bowel cancer, and hopefully to support Agnes as well going through her journey. I hope you enjoyed this series of videos on bowel cancer and Agnes's personal journey and story with bowel cancer. I'll pass you over to Agnes. Thanks for watching.
Hi everyone, welcome back to my YouTube channel. For those who doesn't know me, my name is Agnes Scott. In today's video, I'm going to be very short as I'm still recovering from the side effects of the chemo for bowel cancer. So in today's video, I'm just going to be talking about other side effects, except for the kind of the rare side effects that I've had previously of the chest pain. So today I'm going to be talking about the common side effects, and also I'm just going to mention one side effect of Folfox chemotherapy for bowel cancer, which I encountered, which was the blood clots. So I developed blood clots on my cycle 4 of the chemotherapy, and so I noticed a pain on my neck, and I thought maybe I had slept funny, and then it turns out that it was actually blood clots on my neck. When I went to A&E, they then did a ultrasound, and they were quite huge blood clots. So that's another side effect of the Folfox chemotherapy for bowel cancer. They say it does happen, but it's one that is rare. And other side effects that I had on top of the blood clots on the neck, and there were also blood clots on my lungs as well, like on the base of my lungs, that was discovered after I had a CT scan. And so I'm on blood thinners for that. The injections, they call them Clarkson injections. They're not pleasant because it's every day at the same time, more or less at the same time, that you got to inject yourself on your belly and on your thighs as well. So that's been going on for a while now. Also, the other side effects that I have due to the Folfox chemotherapy for bowel cancer are headache, terrible headaches and jaw pains when eating or even just biting on a banana, anything that just makes your jaw move. It's very terrible pain. It does go away after a few days. Sometimes it lasts for as long as 5 days. And the terrible, awful taste in the mouth. Almost feels like someone has sprayed metal in your mouth, and it's just awful. You can't taste anything at all. And another one is the pins and needles in your hands. As you can see, I'm wearing my gloves because in this kitchen it's quite cold actually. So that kind of brings the pins and needles, especially when I'm leaning on the granite stone on the island because it's quite cold. It just comes up with anything cold and metal. So I've had to get myself some wooden spoons instead of using the normal stainless steel cutlery. They do help, and these gloves, they're very good in kind of like keeping your hands warm so you don't get those pins and needles and when touching the fridge or anything cold really. And another one is when you go out in the cold, your throat, when you inhale the cold air, it feels like it's closing in, and your chest feels like it's crushing. Someone's kind of like crushing ice on your chest. That's how it feels like. So I tend to wrap up quite a lot. I've got like a nice warmish blanket that I use. It does help to cover yourself when going out in the cold. And also I've got a snoot that thankfully my lovely husband bought for me that I use. Yeah, so those are the most common side effects, except obviously for the one with the blood clots on your neck and lungs. And another one is obviously diarrhea and constipation. Awful to be constipated for 3 days, and I usually just take lactulose for that. Yeah, and the fatigue. It is one of the worst side effects. You cannot do anything for yourself, which is really hard when you're used to doing things for yourself. Even things like getting in the bath, I need help with that, getting out of the bath, and yeah, your energy levels from day 3, they just go down. The only energy you're left with is just a few steps to the bathroom and back, and then you're sleeping again. And where you're sleeping with fatigue and you're not actually sleeping properly, because at the same time you are on steroids to help heal or to help prevent any inflammation. So that's another thing that they give you, and that's the side effect of it, the steroid. And also putting on weight, but that is something that can be dealt with at least later on. Yes, so those are the common side effects of Folfox chemotherapy for bowel cancer that I have experienced. And they do give us information on how to cope with them, but it all depends on how you cope with your side effects. It's not the same way as another person, how they cope with their side effects. So this is where we're at, and so this video covers cycle 4 and 5 of Folfox chemotherapy that I had. I had one at home and one in hospital as an inpatient, which went really well, except for obviously the side effects. So, and that's it really for today. I will try and do my best to post more videos more regularly. I noticed that it's been a while since I posted a video. I think it's been a month, purely because there's been a lot happening with me in and out of hospital with all sorts of side effects. Yeah, and thank you everyone for your support and love and your support on my videos. Trying to do as much as I can just to raise the awareness on bowel cancer. And yeah, next time I will be doing another video on me going to see another oncologist, getting some second opinion. So that's where we're at the moment. Thank you very much for your love and support, and please do subscribe and share and and like all those things that needs to be done on the YouTube videos. I think most people know what to do, and I will see you on the next video.